संगच्छध्वं संवदध्वं संगच्छध्वं संवदध्वं संवो मनांसि जानता संवो मनांसि जानता देवाभागं यथा पूर्वे देवाभागं यथा पूर्वे संज्ञानाना उपासते संज्ञानाना उपासते संज्ञानाना उपासते संज्ञानाना उपासते संज्ञानाना उपासते संज्ञानाना उपासते.
Neck movements. Forward and backward neck bending. Caution: avoid this practice in case of severe cervical spondylitis. Start with alert posture Samsthiti. Stand with feet 2-3 inches apart. Keep the hands straight beside the body. Now, keep the hands on the waist. While exhaling, move the head forward slowly and try to touch the chest with the chin. As you inhale, bring the head to the center position. While exhaling, move the head backward comfortably. Bring the head to the center position. This is one round. Repeat for one more round. Right and left neck bending. Caution: do not overstrain during this practice. While exhaling, bend the head slowly to the right and bring the ear as close as possible to the shoulder without raising it. Experience stretching on the left side. As you inhale, bring the head to the center position. While exhaling, bend the head slowly to the left side. Experience stretching on the right side. Inhale and bring the head to the center position. This is one round. Repeat for one more round. Right and left neck twisting. Caution: do not jerk the neck. Keep the head upright. While exhaling, gently turn the head to the right so that the chin is in line with the shoulder. As you inhale, bring the head to the center position. While exhaling, gently turn the head to the left. Feel or experience stretching on the right side. Inhale and bring the head to the center position. This is one round. Repeat for one more round. Neck rotation. Caution: people with neck pain and cervical spondylosis, do this practice carefully. Exhale. Bend the head forward, trying to touch the chest with the chin. Inhale slowly. Rotate the head clockwise in a circular motion. And exhale while coming down. This is one round. Repeat for one more round. Then rotate the head in an anti-clockwise direction. Inhale, go back, exhale and come down. This is one round. Repeat for one more round. Inhale and bring your head to the center position. Exhale. Bring the arms down and relax. Shoulder movements. Shoulders and arms movement. Caution: frozen shoulder patients should do this practice carefully. Start with alert posture, samsthiti. Stand with feet 2-3 inches apart. Place the hands by the sides. Keep the fingers together, pointing downwards. While inhaling, move both the arms from the sides up above the head, with the palms facing outward. Exhale and bring them down. This is one round. Repeat for one more round. Shoulder rotation. Stand straight. Inhale and raise both the arms up to shoulder level by the sides. Bend the arms at the elbows. Place the fingers on the respective shoulders. Try to touch the elbows in front of the chest, and then rotate both the elbows and shoulders in a circular manner. This is one round. Repeat for one more round. Inhale while raising the arms and exhale as you bring them down. Repeat the same in a reverse manner for 2 times. Inhale while raising the arms and exhale as you bring them down. Now inhale and stretch the elbows by the sides. Exhale, bring the arms down and relax. Trunk twisting. Caution: in case of vertebral disorders, do this practice under guidance. Start from the alert posture. Stand with feet about 1 foot apart. Raise arms to the chest level, facing each other, and keep them parallel. While exhaling, twist the body towards the right side so that the left palm is close to the right shoulder. Come back as you inhale. While exhaling, rotate the trunk and spine towards the left side. Come back with inhalation. This is one round. Repeat for one more round. Slowly bring the arms and feet back together as you exhale. Relax. Knee movement. Caution: in case of arthritis and obesity, do this practice carefully. Start in an alert posture. Then keep the feet 1 foot apart. Inhale. Move the arms up the shoulder level from the front, with palms facing downwards. Exhale. Bend the knees and bring down your body to the half squatting position. In the final position, both the arms and thighs should remain parallel to the ground. Come back as you inhale. This is one round. Repeat for one more round. Come back with inhalation. Slowly return the arms as you exhale and bring the feet together. Relax. Ankle movements. Benefits. The exercise relieves rheumatism of the ankles and strengthens the toes and the feet. Caution: avoid this practice in case of acute conditions of arthritis. Ankle stretch. Stand straight with the feet few inches apart. Place the hands on the waist. Inhale. Lift your right foot up to at 9 inches off the ground. Now, stretch the ankle joint forward and backward. Repeat 2 more times. Bring the right foot down. Now repeat with another foot. Inhale. Lift your left foot up to at 9 inches off the ground. Now stretch the ankle joint forward and backward. Repeat 2 more times. Bring the left foot down. Release the hands and relax. Ankle rotation. Stand straight with the feet few inches apart. Place the hands on the waist. Inhale. Lift your right foot up at 9 inches off the ground. Slowly rotate the right foot clockwise 3 times. Now, repeat the rotation in anti-clockwise 3 times. Bring the right foot down. Now, repeat the same practice with another foot. Inhale. Lift your left foot up at 9 inches off the ground. Slowly, rotate the left foot clockwise 3 times. Now, repeat the rotation anti-clockwise 3 times. Bring the left foot down. Release the hands and relax. Surya Namaskar, Sun Salutation. Surya or Sun is the source of energy to all the living beings on this planet Earth. Surya Namaskar is the set of 7 yogic poses performed in 12 steps in the early morning to refresh and energize the body and mind for the day activity. It is being practiced as part of yoga sadhana or practice over the centuries for healthy living. Benefits: it helps to increase the flexibility, lungs capacity, strength, endurance, and develop a healthy spine. It makes the mind alert and fresh. Caution: avoid during spinal injury. Practice it as per need and capacity. Girls should avoid during the menstrual periods. Starting position: Samasthiti. Stand upright with feet together and arms by the side of the body. Balance the body equally on both feet. Inhale. Raise both the arms up and join the palms together. Exhale. Bring them in front of the chest, as in Namaskara Mudra or prayer position. Hastotana Asana. Inhale. Raise both the arms up, keeping the arms close to the ears. Stretch the body as much as possible and bend the trunk backward without bending the knees. Padahastasana. Exhale. Bend forward from the lowermost part of the spine and base of the buttocks. Place hands on the floor by both sides of the feet. Try to touch the knees with forehead without bending the knees. Ashwasanchalanasana. Inhale. Take the right leg backward as far as possible. Bring the right knee to the floor. Keep the left foot on the floor between the palms. Arch the spine back and look up. Parvatasana. Exhale. Take the left leg back. Lift the hips and tailbone up and lower the head and chest downwards in an inverted V posture. Keep the head between the arms and soles touching the ground. Ashtanga Namaskarasana. Breathe normally. Lower the knees, chest and chin to the floor. In the final position, only the toes, knees, chest, hands and chin should touch the floor simultaneously. The buttocks and abdomen should be raised. Bhujangasana. Inhale. Lower the hips. Raise the head up and push the chest up. Raise the trunk up to the navel with spine arched back. Keep palms on the ground and bend backwards. Parvatasana. Exhale. Lift the hips up and lower the head and chest downward in an inverted V posture. Keep head between the arms and soles on the ground. Ashwa Sanchalanasana. Inhale. Bend the right leg and bring it forward. And keep the right foot on the ground between the arms. Keep the left leg backward with left knee touching the ground. Arch the spine back and look up. Padahastasana. Exhale. Bring the left leg forward beside the right foot. Place both palms beside outer sides of the feet on the ground and head touching the knees. Hastottana Asana. Inhale. Raise arms and torso. Take the arms straight above the head and bend the trunk backwards as much as possible. Namaskara Asana. Exhale. Come to the straight position. Slowly bring the arms down and join the palms in front of the chest as in Namaskara Mudra or prayer position. Bring the arms down and relax. Tadasana. Palm tree posture. Tada means palm tree or mountain. This asana teaches one to attain stability and firmness and forms the base for all the standing asana. Benefits. This asana brings stability in the body, helps to clear up congestion of the spinal nerves and corrects faulty posture. Caution. Avoid lifting the toes in case of acute cardiac problems, varicose veins and vertigo. Alert posture. Stand with feet 2-3 inches apart. Place the hands by the sides. Inhale. Lift the arms to the shoulder level from the front and interlock the fingers. Exhale. Turn the palms outwards. Now inhale and stretch the arms over your head. Raise the heels off the floor and balance on the toes. Maintain the final position for 3 to 5 breaths with body awareness. Bring the heels down. Release the interlock of the fingers. Exhale. Bring the arms down by the sides and come back to the starting position. Relax. Utkat Konasana, the goddess pose. Utkata means fierce, intense or powerful, and Konasana means angle posture. Benefits. This is a powerful standing yoga posture that builds strength, stability and focus. It also opens inner groin and chest, tones the pelvic floor muscles, which is beneficial for reproductive health. Caution. Individuals with issues related to the hips or any injuries in the hamstrings, quadriceps, glutes or pelvis, as well as those who have recently undergone hip replacement or knee surgery, should avoid this pose. Technique. Stand straight with feet 3 feet apart and arms alongside the body. Turn feet outward at a 45-degree angle. Bend knees and lower into a squat until thighs are parallel to the floor. Keep the spine straight. Raise arms sideways to shoulder level. Bend elbows at 90 degrees with palms facing forward. Hold the position for a few seconds. Breathe normally. Straighten the elbows and lower the arms while exhaling. Straighten the knees. Return the feet to the normal position and bring the legs together. Relax. Urdhva Hastottana Asana, upward side bend pose Urdhva means upward. Hasta means arms. And Uttana means stretched up. In this asana, arms are stretched upward. Therefore, the asana is named Urdhva Hastottana Asana. Benefits. It strengthens the trunk, core, upper and lower limb muscles. It enhances the thoracic cavity movement. Cautions. Avoid in case of recent shoulder or neck injury. People with hypertension, vertigo or balance issues should practice with caution. Technique. Stand straight with the feet a few inches apart and arms relaxed alongside the body. Inhale. Lift both arms to shoulder level in front of the body. Interlock the fingers and turn the wrists outward with exhale. Inhale. Raise the interlocked arms above the head, keeping them close to the ears. Exhale. Slowly bend the torso to the right side from the waist. Hold the position for a few seconds with normal breathing. Inhale. Return to the upright position. Exhale. Slowly bend the torso to the left side from the waist. Hold the position for a few seconds with normal breathing. Inhale. Return to the upright position. Exhale. Release the interlocks. Bring the arms down and relax. Kati Chakrasana, lumbar wheel posture. Kati means waist and chakra means a wheel. In this asana, the waist moves like a wheel. Therefore, it is named as Kati Chakrasana. Benefits. The waist becomes slim and supple, and the chest expands. It relieves constipation and makes the lumbar region strong. It strengthens shoulders, neck, arms, abdomen, back, and the thighs. Caution. Do it slowly with normal breathing. Cardiac patients shall do with care. Avoid this practice in case of severe back pain, vertebral and disc disorders, after abdominal surgery and during menstruation. Stand straight with the feet shoulder width apart and arms relaxed alongside the body. Inhale. Lift both arms to shoulder level in front of the body, with palms facing each other. Exhale. Twist the torso to the right so that the left palm moves close to the right shoulder and the left elbow remains at shoulder level. Hold the position for a few seconds with normal breathing. Inhale. Return to the center. Exhale. Twist the torso to the left so that the right palm moves close to the left shoulder and the right elbow remains at shoulder level. Hold the position for a few seconds with normal breathing. Inhale. Return to the center. Exhale. Bring the arms down alongside the body. Relax. Trikonasana, the triangle posture. Trikona means triangle. Tri means three and kona means angle. As the asana resembles the shape of a triangle made by the trunk, arms and legs, this asana gets the name Trikona Asana. Benefits. This asana makes the spine flexible, strengthens calf, thigh and waist muscles, and improves the capacity of lungs. Caution. Avoid this posture if you have slipped disc or sciatica. Avoid this posture after undergoing an abdominal surgery. Do not try beyond limits and overdo the lateral stretch. If you cannot touch the feet, you can reach for the knees instead. Assume the alert posture and step the feet 3 feet apart. Inhale and raise both the arms from the sides up to the shoulder level with palms facing outwards. Turn the right foot towards the right side. Exhale. Slowly bend to the right side and place the right hand just behind the right foot. Turn your head and gaze at the tip of the left middle finger. The left arm is straight in the line with the right arm. Maintain the final position for 3 to 5 breaths with body awareness. Inhale. Slowly come up and bring the right foot back. Repeat on the other side. Turn the left foot towards the left side. Exhale. Slowly bend to the side and place the left hand just behind the left foot. Turn your head and gaze at the tip of the right middle finger. The right arm is straight in line with the left arm. Maintain the final position for 3 to 5 breaths with body awareness. Inhale. Slowly come up and bring left foot back. Exhale. Bring the arms down and feet together. Come to the starting position and relax. Parvatasana, mountain posture. Parvatasana is derived from Sanskrit. Parvata meaning mountain. Asana meaning posture or pose. Thus, Parvatasana means mountain posture, symbolizing the stability, strength, and stillness of a mountain. Benefits. This practice helps to induce mental calmness and tranquility. Caution. In case of severe arthritis, slip disc, knee injuries, and ankle pain, this asana should be avoided. Sit with both legs extended forward. Place the hands beside the body, with fingers pointing forward. Fold the knees. Place the right foot on the left thigh and the left foot on the right thigh. Ensure the knees touch the ground. Sit with spine erect. Inhale. Raise both arms above the head, with palms joined together. Keep the arms straight and close to the ears. Maintain the posture with normal breathing for a few seconds. Exhale. Slowly bring the arms down and stretch both legs forward into Shithila Dandasana. Relax. Ardha Matsyendrasana, the spinal twist pose. It is the simple version of Matsyendra Asana. It is named after Yogi Matsyendranath. Benefits. This is good for adrenal glands, kidney, liver, and spleen. Caution. Must be avoided with severe spinal injuries and during menstruation or pregnancy. Sit with both legs extended forward. Place the hands beside the body with fingers pointing forward. Bend the left leg and place the left foot flat on the floor outside the right knee. Fold the right leg and bring the right heel near the left hip. Take the left arm back and place the left palm on the floor behind the spine for support. Inhale. Twist the torso to the left. Exhale. Raise the right arm up and bring the right arm around the left knee. Place the right palm beside the left foot. Keep the spine erect and shoulders relaxed. Gently turn the head to look over the left shoulder. Maintain this posture with normal breathing for a few seconds. Inhale. Return to the center and release the arms and legs. Bend the right leg and place the right foot flat on the floor outside the left knee. Fold the left leg and bring the left heel near the right hip. Inhale. Take the right arm back and place the right palm on the floor behind the spine for support. Keep the spine erect and shoulders relaxed. Raise the left arm up. Exhale and bring the left arm around the right knee. Place the left palm beside the right foot. Twist the torso to the right. Gently turn the head to look over the right shoulder. Maintain this posture with normal breathing for a few seconds. Inhale. Return to the center and release the arms and legs. Relax. Ustrasana, camel posture. Ustra means camel. The body in this pose will resemble the hump of a camel, hence the name. Benefits. Ustrasana is extremely useful for defective eyesight. This is useful in relieving back pain and neck pain. It helps to reduce fat over the abdomen and hips. It is helpful in digestive problems. A word of caution. Those suffering from high blood pressure, heart disease, hernia should not practice it. Start with a long sitting posture. Sit straight with legs stretched out in the front, palms resting on the ground and fingers pointing forward. This is Dandasana. Fold the right leg at the knee and place the foot under the right buttock. Similarly, fold the left leg and place the left foot under the left buttock. Place the hands on respective knees and stand on your knees. Now bring the knees and feet a few inches apart. While inhaling, bend backwards without jerking the neck. Exhale. Place the right palm on right heel and left palm on left heel. Weight of the body should be evenly supported by the arms and legs. Maintain the final position for 3 to 5 breaths with body awareness. Inhale. Come back to kneeling position. Exhale. Sit in Vajrasana. Bend a little towards the right side to take the left leg out and extend it. Similarly, extend your right leg and return to the starting position. Relax. Janu Shirsasan, head to knee pose. Janu Shirsasan literally means head to knee pose, referring to the movement of bringing the head toward the knee of the extended leg while in a seated forward bend. Benefits. Improves flexibility in the hamstrings, calves and spine. Stimulates abdominal organs, enhancing digestion. Can help with menstrual discomfort and menopausal symptom. Caution. Avoid in case of lower back injury or slipped disc. Avoid deep forward bending in pregnancy. Practice only under expert supervision. People with knee issues should keep the bent leg slightly extended or supported. Sit with both legs extended forward. Place the hands beside the body, with fingers pointing forward. Bend the left knee and place the sole of the left foot against the inner right thigh. Align the torso straight, facing the extended right leg. Inhale. Raise both arms up overhead, keeping the spine straight. Exhale. Bend forward from the hips and bring the arms down to hold the right foot or ankle. Try to touch the forehead to the right knee without hunching. Maintain the posture with normal breathing for a few seconds. Inhale. Slowly raise the torso and bring the arms up. Exhale. Bring the arms down and straighten the left leg. Now, practice on other side also. Bend the right knee and place the sole of the right foot against the inner left thigh. Align the torso straight, facing the extended left leg. Inhale. Raise both arms up overhead, keeping the spine straight. Exhale. Bend forward from the hips and bring the arms down to hold the left foot or ankle. Try to touch the forehead to the left knee without straining. Maintain the posture with normal breathing for a few seconds. Inhale. Slowly raise the torso and bring the arms up. Exhale. Bring the arms down and straighten the right leg back. Relax in Shithila Dandasana. Gomukhasana, cow face pose. Gomukha consists of two words, Go meaning cow and Mukha meaning face. In this asana, the knees, thighs and calves together make a form that resembles cow's face. Benefits. It enhances the respiratory health. It is useful in shoulder and neck pain management. Precaution. Avoid this asana in case of joint injuries, acute pain in shoulders and piles problem. Sit with both legs extended forward. Place the hands beside the body and fingers pointing forward. Bend the right leg and bring the right heel beside the left buttock. Now, bend the left leg and place the left heel beside the right buttock. Keep the spine straight and sit evenly on both buttocks. Raise the right arm up. Bend the elbow and bring the right hand down behind the upper back. Simultaneously, bring the left arm behind the back and try to clasp the fingers of both hands. Keep the head and neck aligned with the spine. Breathe normally and hold the posture few seconds or as comfortable. Gently release the hands and stretch both legs forward into Dandasana. Repeat the same steps on the other side by switching leg and arm positions. Breathe normally and hold the posture few seconds or as comfortable. Gently release the hands and stretch both legs forward into Shithila Dandasana and relax. Marjari Asana, cat stretch pose. This asana, known as cat pose, is inspired by the way a cat stretches its spine. Benefits. This asana improves the flexibility of the neck, shoulders and spine. Caution. Those who have knee pain should avoid this practice. Sit with both legs extended forward. Place the hands beside the body and fingers pointing forward. Fold the right leg and place the foot under the right buttock. Fold the left leg and place the foot under the left buttock. Place both the feet in such a way so that the big toes touch each other. Coming into Vajrasana. Keep the spine erect and both hands on the respective knees. Lean forward and place the hands flat on the floor beneath the shoulders. The knees slightly separated. The hands should be in line with the knees. The arms and thighs should be perpendicular to the floor. Keep your head in a neutral position. Gaze forward. Inhale. Raise the head and tailbone upward. Arch the back downward. Expand the chest and abdomen. Exhale. Tuck the chin to the chest. Press the palms and knees into the floor. And arch the spine upward like a cat. Synchronize each movement with the breath. Inhale for the upward or cow stretch. Exhale for the downward or cat stretch. Repeat this cycle slowly and rhythmically for few rounds. Slowly come back in Vajrasana. Gently stretch both legs forward into Shithila Dandasana and relax. Bhujangasana, the cobra posture. Bhujanga means snake or cobra. In this asana, the body is raised like the hood of a snake. Benefits. This asana relieves stress and constipation and reduces abdominal fat. It helps to relieve backache and bronchial problems. Caution. Those who have undergone abdominal surgery should avoid this asana for 2-3 months. Those who are suffering from hernia or ulcers should not practice this asana. Start with Makarasana. Now join the legs. Stretch your arms forward and rest the chin on the ground. Now place your palms beside the chest and elbows close to the body. Inhale slowly and lift the head and chest up to the navel region with the help of the spinal muscles. Keep the elbows parallel. Maintain the funnel position for 3 to 5 breaths with body awareness. Exhale. Bring the head down and rest your chin on the ground. Relax in Makarasana. Makarasana, the crocodile posture. In Sanskrit, Makara means crocodile. In this asana, the body would resemble crocodile, hence this name. Benefits. This asana promotes relaxation of the whole body. It helps in the recovery of back problems. Caution. Avoid this practice in case of pregnancy and frozen shoulders. This asana is practiced for relaxation in all prone postures. Start in Vajrasana. Slowly lie down on the stomach with feet together and toes pointing outwards. Place the chin on the ground. Stretch your arms forward. Open the feet apart with toes pointing sideways. Bend your elbows and rest the chin on the hands. Lift the head up and place your cheek on the hands. Close the eyes and allow the entire body to relax. Maintain the funnel position for 3 to 5 breaths with body awareness. Remain aware of the body and breathing. Shalabhasana, the locust posture. Shalabha means a locust. Benefits. This asana relieves in sciatica pain and lower backache. It helps to reduce fat in the thighs and buttocks. And it is also good in weight management. It helps to improve the capacity of lungs. Caution: one should proceed cautiously in case of severe lower back pain. People with high blood pressure, peptic ulcer or hernia should avoid this posture. Start with Makarasana. Now join the legs and place both hands beside the body, palms facing downwards. Inhale and lift both the legs off the floor without bending the knees. Maintain the funnel position for 3 to 5 breaths with body awareness. Exhale and bring the legs down to the floor. Relax in Makarasana. Dhanurasana, bow pose. Dhanurasana gets its name from Dhanur, which means bow. In the funnel posture, body looks like a bow with the strings, hence the name. Benefits: stimulates and massages the pancreas, helping in insulin regulation, enhances digestion and metabolism, improves function of liver, kidneys and abdominal glands, strengthens back muscles, improves posture and reduces fatigue. Caution: avoid this pose if you have hernia, gastric ulcers or intestinal issues, pregnancy, recent abdominal surgery and severe back pain or spinal injury. Lie flat on your stomach in Makarasana. Gently bring your legs together. Raise your chin. Stretch your arms forward and rest your chin on the ground. Bend both knees and bring your heels close to your buttocks. Reach back with your hands and hold your ankles. While inhaling, lift your chest and thighs off the floor simultaneously. Gently pull your ankles with your hands so that your torso and legs lift, forming a bow shape. Keep your gaze forward. Breathe deeply and hold the pose for a few seconds, according to your capacity. Exhale and gently lower your chest, thighs and legs to the floor. Release your ankles and relax in Makarasana. Pavana Muktasana, the wind-releasing posture. Pavana means wind and Mukta means to release or to make free. As the name suggests, this asana is useful in removing wind or flatulence from the stomach and the intestine. Benefits: it removes constipation, gives relief from flatulence, decreases the bloating sensation in the abdomen, and aids digestion. It generates deep internal pressure and improves stretching of the highly complicated network of muscles, ligaments, and tendons in the pelvic and waist regions. It tones up the back muscles and spinal nerves. Caution: avoid this practice in case of abdominal injuries, hernia, sciatica, severe back pain, and during pregnancy. Lie comfortably on the ground with legs stretched out, hands placed by the sides and palms facing downwards. Bend both the knees. Exhale. Bring the knees towards the chest. Inhale. Interlock the fingers and clasp the shin below knees. Exhale. Raise the head up until the chin or nose touches the knees. Maintain the final position for 3 to 5 breaths with body awareness. Inhale. Bring the head back to the ground. Exhale. Release the legs back to the floor. Lie down in supine position. Relax. Matsya Asana, fish pose. In yogic tradition, Matsya Asana is believed to be the pose that allows one to float like a fish in water. Benefits: enhances breathing and lung function, stretches spine, chest and neck, strengthens upper back and core, may relieve stress and tension. Caution: avoid with high or low BP or migraines. Be careful with neck, back issues. Not for severe asthma or recent surgery. Lie flat on the back with legs and feet together in a straight line. Place the hands and arms close to the body with the palms facing down. Slowly lift your legs and fold the knees. Place the right foot on the left thigh and the left foot on the right thigh. Ensure the knees touch the ground. Place the palms on the floor beside the head, with the fingers pointing towards the shoulders. Lift the chest slightly. Take the head back and lower the crown of the head to the floor with the support of the palms. Slowly release the hands. Hold the big toes and rest the elbows on the floor. Close the eyes and breathe slowly and deeply for a few seconds. Return to the starting position. Place the palms on the floor beside the head. Exhale slowly and lower the torso and head to the floor. Place your arms beside your body. Slowly straighten your legs Now split legs apart and palm facing upwards and relax in Shavasana. Sarvanga Asana. Shoulder stand pose. Sarvanga Asana consists of Sarva, meaning all or whole, Anga, meaning limbs of body, and Asana, meaning posture. It affects all parts of body, hence the name. Benefits: it helps in regulating functioning of endocrine glands, especially the thyroid glands. Improves circulation of blood. Caution: avoid with high blood pressure or heart conditions. Contraindicated during menstruation and pregnancy. Lie flat on the back with legs and feet together in a straight line. Place the hands and arms close to the body with the palms facing down. Slowly raise the legs to the vertical position, keeping them straight. When the legs are vertical, press the arms and hands down on the floor. Slowly and smoothly roll the buttocks and spine off the floor. Turn the palms of the hands upward. Bend the elbows and place the hands behind the ribcage, slightly away from the spine to support the back. In the final position, the legs are vertical, together and in a straight line with the trunk. Relax the whole body in the final pose for as long as is comfortable with normal breathing. To return to the starting position, lower the legs over the head. Then, place the arms and hands close to the body. Do not lift the head. When the buttocks reach the floor, lower the legs, keeping them straight. Relax the body in Shavasana. Setubandhasana, the bridge posture. Setubandha means formation of bridge. In this posture, the body is positioned like a bridge, hence the name. This is also called Chatuspadasana. Benefits: it relieves depression and anxiety and also strengthens the lower back muscles. It stretches abdominal organs, improves digestion, and helps to relieve constipation. Caution: people suffering from ulcer, hernia, etc. should not practice this asana. Lie down on the ground. Stretch out your legs comfortably and place the palms facing downwards. Bend both the legs at the knees and bring the heels near the buttocks. While holding both the ankles as per your convenience, inhale, slowly raise your buttocks and trunk up as much as you can to form a bridge, and maintain the final position for 3 to 5 breaths with body awareness. Exhale, slowly bring your hips down and straighten the legs in supine position. Relax. Kapalabhati. Kapala means skull. Bhati means to shine or to cleanse. It is a cleansing practice which helps to clean the frontal sinuses and upper respiratory tract. Benefits: this practice purifies the frontal air sinuses, helps to overcome cough disorders. It is useful in treating cold, rhinitis, sinusitis, asthma, and bronchial infections. It rejuvenates the whole body and keeps the face glowing and vibrant. It strengthens the nervous system and tones up the digestive organs. A word of caution: avoid this practice in case of cardiac conditions, giddiness, high blood pressure, vertigo, chronic bleeding in the nose, epilepsy, migraine, stroke, hernia, gastric ulcer, pregnancy, and during menstrual cycle. Sit in any comfortable position. Keep the spine and head straight with eyes closed. Place the hands on the knees in Jnana Mudra. Inhale deeply through both the nostrils till you start to experience fullness in the pelvic area and expansion in the chest. Expel the breath with forceful contractions of the lower abdominal muscles and let the inhalation be passive. Let us begin the first round of Kapalabhati with 20 strokes. Exhale deeply and relax. This is one round of Kapalabhati. Repeat 2 more rounds with 20 strokes each. Pranayama. Nadi Shodhana or Anulom Vilom Pranayama. Alternate nostril breathing. The main characteristic feature of this pranayama is alternate breathing through the left and right nostrils without or with retention of breath, that is kumbhaka. Benefits: the main purpose of this pranayama is to purify the principal channels of carrying energy, called nadis, hence nourishes the whole body, induces tranquility and helps to improve concentration, increases vitality and lowers the level of stress and anxiety. It elevates cough disorders. Start with sitting in any comfortable posture. Breath should be slow, steady and controlled. Keep spine and the head straight with the eyes closed. Relax the body with few deep breaths. Keep the left palm on the left knee in Jnana Mudra and the right hand should be in Pranayama Mudra with the middle and the index fingers folded like this. Close the right nostril with the right thumb and exhale completely. Now inhale through the left nostril. recognize the touch of air moving through your body as prana. Then, close the left nostril with the ring and little finger of the right hand and exhale through the right nostril. Now, inhale through the right nostril. Close the right nostril with the thumb and exhale through the left nostril. This is one round of Nadi Shodhan Pranayama. Repeat it for 4 more rounds. Bhramari Pranayama. Bhramari is derived from Bhramara, which means black bee. During the practice of this pranayama, the sound produced resembles the buzzing of a black bee, hence the name. Benefits: it relieves stress and helps in alleviating anxiety, anger, and hyperactivity. It creates a soothing effect on the nervous system and mind. It is a great tranquilizer and found good in the management of stress-related disorders. It is a useful preparatory pranayama for concentration and meditation. Caution: please avoid this practice in case of nose and ear infections. Sit in any comfortable posture. Keep the spine and head straight with the eyes closed. Place the hands on the knees in Jnana Mudra and inhale deeply through the nose. Exhale slowly, making a deep humming sound. Repeat 1 more round. Practice the Bhramari Pranayama with Sanmukhi Mudra. Using your index fingers, gently close your eyes. Then place the middle finger beside your nose without fully covering it. Place your ring finger on your upper lip and your pinky finger on your lower lip. Finally, rest your thumbs on your ears as demonstrated in the video. Inhale deeply through the nose. Exhale slowly, making a deep humming sound. Repeat 1 more round. Ujjayi Pranayama. Victorious breath. Ujjayi means victorious. Ujji is the root, which means to conquer or acquire by conquest. In English, Ujjayi is known as the psychic breath because of its effect on the mind. Benefits: this practice soothes the nervous system and calms the mind. Caution: people who are too introverted by nature should not perform this practice. Sit in any meditative posture, Sukhasana or Padmasana. Rest your hands on your knees in Jnana Mudra with your eyes closed. Keep your spine and head straight. While inhaling, gently contract the glottis so that a soft snoring sound like the breathing of a sleeping baby is produced in the throat. Then exhale slowly through the both nostril. This is 1 round. Repeat for a few more rounds. Dhyana. Sit in any comfortable position. Place the hands on the knees. Close your eyes. Now adopt Dhyana Mudra and sit in a slightly upturned face. You need not concentrate. Just maintain a mild focus between the eyebrows and be conscious of your breath. Let them flow freely. Just observe the flow. If possible, let the thoughts dissolve. Yoga Nidra, yogic sleep. Yoga Nidra is a Sanskrit term that translates to yogic sleep. It is a deep relaxation and meditative practice that guides the body into a state between wakefulness and sleep while maintaining awareness. In this state, the body is completely relaxed, the mind is quiet, and the practitioner remains conscious, unlike in normal sleep. Benefits: to reduce stress, improves sleep quality, regulates blood pressure, release pain, and balance emotion. Lie down comfortably on your back in Shavasana. Keep your legs slightly apart. Arms by your sides with palms facing upward. Close your eyes gently and keep your body completely still. Take a few deep breaths. Inhale slowly. Exhale completely. Let your body relax with each breath. Mentally, prepare yourself to stay awake and aware throughout the practice. Move your awareness through your body part by part. Right hand thumb, index finger, middle finger, ring finger, little finger, right palm, wrist, forearm, elbow, upper arm, shoulder, right waist, hip, thigh, knee, calf, ankle, heel, sole, big toe, all the toes. Now, move to the left side in the same sequence. After completing both sides, bring your awareness to the back, shoulder blades, spine, lower back, buttocks. Then to the front, stomach, chest, collarbones, throat, face, eyes, and top of the head. Now become aware of your whole body lying on the floor. Feel stillness and calmness. Begin to observe your natural breath. Without changing it, witness each inhalation and exhalation. Allow your body and mind to sink into deep relaxation. Stay in this state for a few minutes, resting in awareness and silence. When ready, slowly bring your awareness back to the physical body. Now, gently open your eyes. Slowly move your fingers and toes. Then the feet together.
सर्वे भवन्तु सुखिनः सर्वे सन्तु निरामयाः सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत् मा कश्चित् दुःखभाग् भवेत्। ॐ शान्ति